Hello everyone, my name is Kabir and in this video I will help you understand and memorize the brachial plexus. So, the origin of the brachial plexus is from its roots. Multiple roots combine to give us trunks. Trunks will have divisions and divisions will again combine to form cords and these cords will finally give out branches. You can remember this flow of the brachial plexus by remembering a simple mnemonic, that is, remember to drink cold beer, and that will cover the roots, trunks, divisions, cords, and branches. The roots of the brachial plexus are made up by the anterior rami of spinal nerves. Spinal nerves emerge out of the vertebral column through the spaces between two consecutive vertebrae. So on the left side here I have drawn some vertebrae. So between C4 and C5 there will be a spinal nerve which emerges out. Between C5 and C6 there will be one. Also one from C6 and C7, from C7 and T1, and T1 and T2. In case of the cervical spinal nerves, the name of the spinal nerve depends on the vertebra which is present under the nerve. So the name of this cervical spinal nerve would be C5. Similarly, this one would be named as C6 because the C6 vertebra is present under it. Same way, this one will be called as C7. For the thoracic spinal nerves, we look at the vertebra which is present above the nerve. So in that case, this thoracic spinal nerve will be named as T1. Now the spinal nerve which arises from between C7 and T1 is an exception and we name it as C8. Remember, we do not have any C8 vertebra in our body. So the anterior rami of these spinal nerves, that is C5, C6, C7, C8 and T1, forms the roots of the brachial plexus. These roots then combine. So the C5 and C6 root will combine and so will the roots C8 and T1. But the C7 root will move straight ahead. So now what we have here are trunks. So the C5 and C6 roots combine to form the superior trunk. The C7 forms the middle trunk and C8 and T1 combine to form the inferior trunk. Each of these trunks will now divide into two divisions and those will be anterior and posterior divisions. So anterior, posterior. Same for the middle, anterior, posterior. Anterior and posterior. So now we have 6 divisions for the brachial plexus, 3 anterior and 3 posterior. Now I want you to remember that we have 3 cords which form the brachial plexus. Firstly, we have the medial cord, then we have the lateral cord, and lastly the posterior cord. So you can see the word medial has 6 letters, the word lateral has 7 letters, and the word posterior has how many? 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 letters. So we have written them in the order of how many letters each word has. So since medial has the least number of letters, medial cord will arise from one division. The lateral cord will arise from 2 divisions and the posterior cord will arise from 3 divisions. And you can remember how many divisions lead to the formation of these cords by just arranging them by the number of letters that they have in them. Medial has the least number of letters, it only arises from 1 division. Posterior has the most number of letters and it arises from 3 divisions, and lateral one is in the middle and it arises from 2 divisions. So keeping this in mind, we'll see that the anterior division of the superior trunk and the anterior division of the middle trunk combine to form a cord. Now this cord is formed by the combination of two divisions. So which one will it be? It will be the lateral cord. Then the posterior divisions of all the three trunks, that is the superior, middle and inferior trunks, will combine to form another cord. Now this cord is formed by three divisions. So what should be the name? It will be the posterior cord. And the anterior division of the inferior trunk continues singly. So what will be the name of this cord? This one will be the medial cord. So that is how you can remember the names of the cords and the divisions from which they arise. These three cords will now give out branches. Firstly, a branch of the lateral cord and a branch of the medial cord will combine to form a nerve, which we call the median nerve. The lateral cord will also give out another branch, which is called as the musculocutaneous nerve. The posterior cord will give out two branches. The first one being the axillary nerve and the second one being the radial nerve. And lastly, the medial cord will also give out another branch, which is the ulnar nerve. So these are the five main nerves of the brachial plexus that we must remember, and I'll repeat their cords once again. The musculocutaneous nerve is a branch of the lateral cord. The median nerve is formed by one branch from the lateral cord and another branch from the medial cord. The axillary nerve is a branch of the posterior cord. The radial nerve is also a branch of the posterior cord, and the ulnar nerve is a branch of the medial cord. These are the five main branches. Now we'll also talk about the other branches of the brachial plexus. So firstly, I want you to know that there will be one branch from C5, one branch from C6 and one branch from C7, which will combine to form a nerve, which is called as the long thoracic nerve, and this nerve will innervate the serratus anterior muscle. From the C5 root, we will also have another branch, which is a branch to the phrenic nerve. From the C5 root, we will also have a third branch, which is called as the dorsal scapular nerve. So we'll just revise what branches arise directly from the C5 root. There's a branch to the phrenic nerve and the dorsal scapular nerve. And from the roots C5, C6 and C7, we have the long thoracic nerve. Now from the superior trunk, we have two branches. So we have 1 and 2. The first branch of the superior trunk is the suprascapular nerve, and the second branch is the nerve to the subclavius. Alright. Then from the lateral cord, we also have another branch, which is called as the lateral pectoral nerve. This one is quite easy to remember because the lateral pectoral nerve arises from the lateral cord. And from the medial cord, we also have another branch, which is the medial pectoral nerve. Medial pectoral nerve. So the pectoral nerves are quite easy to remember. Lateral one arises from the lateral cord. Medial one arises from the medial cord. Now, from the posterior trunk, we have three branches. 1, 2, 3. So the center one, the branch in the center, is the branch of the thoracodorsal nerve. We call this as a thoracodorsal nerve, or also we can call it as the nerve to the latissimus dorsi. And the two branches which are present on either side of the thoracodorsal nerve are the upper and the lower. But which one? They are the subscapular nerves. Subscapular nerves. So three branches from the posterior cord: the upper subscapular nerve, the thoracodorsal nerve, and the lower subscapular nerve. And then from the medial cord, we also have two more branches. So the first one is the medial cutaneous nerve of the arm, and the second one is the medial cutaneous nerve of the forearm. So these are all of the branches of the brachial plexus. So I want you to look at all of the branches of the brachial plexus once again. We have five main nerves, which are the musculocutaneous nerve arises from the lateral cord, median nerve arises from the lateral and the medial cord, axillary nerve and radial nerve arise from the posterior cord, and ulnar nerve arises from the medial cord. From the C5 root, we have one branch to the phrenic nerve and another one which is the dorsal scapular nerve. The C5, C6 and C7 roots come together to form the long thoracic nerve. From the superior trunk, we have two branches as well. One of them being the suprascapular nerve and the second one being the nerve to the subclavius muscle. The other branch of the lateral cord is the lateral pectoral nerve. From the posterior cord, we also have three other branches. We have the upper subscapular nerve first, followed by the thoracodorsal nerve or the nerve to the latissimus dorsi, and the third one being the lower subscapular nerve. And lastly, the other branches of the medial cord are the medial pectoral nerve, the medial cutaneous nerve of the arm, and the medial cutaneous nerve of the forearm. So the drawing is a bit messy, but I hope I got the point across. We'll look at some more images of the brachial plexus now. But before that, I also want you to know that these roots C5, C6, C7, C8 and T1 also arise from the other side of the vertebral column, and we have the same brachial plexus in both the arms, but just mirrored. So let's have a look at this image of the brachial plexus. We have the roots C5, C6, C7, C8 and T1. C5, C6 and C7 form the long thoracic nerve. C5 also gives out a dorsal scapular nerve. Remember, C5 will also give out a branch to the phrenic nerve. C5 and C6 will combine to form the superior trunk. C7 will go on to form the middle trunk. C8 and T1 will form the inferior trunk. From the superior trunk, we also have the nerve to the subclavius muscle and one suprascapular nerve. So all of these trunks will now give out two divisions, that is the anterior and the posterior, anterior posterior, anterior posterior divisions. So the anterior divisions of the superior and the middle trunk will combine to form the lateral cord. The posterior divisions of all the three trunks will combine to form the posterior cord, and the anterior division of the inferior trunk will go on to form the medial cord. Now, from the lateral cord, we have two main nerves, that is the musculocutaneous nerve, and another branch of the lateral cord will combine with a branch of the medial cord to form the median nerve here. We can see it. The medial cord will also give out an ulnar nerve. And the two main branches of the posterior cord are the axillary nerve and the radial nerve. Now, the smaller branches of the brachial plexus, apart from these five main nerves, will be the lateral pectoral nerve from the lateral cord and the medial pectoral nerve from the medial cord. From the posterior cord, we will also have the upper subscapular nerve here, the lower subscapular nerve here, and the thoracodorsal nerve or the nerve to the latissimus dorsi. And from the medial cord, we will also have a medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. Let's also look at a real life image of the brachial plexus. So we can see the roots C5, C6, C7, C8, T1. They will form the chords superior, middle, inferior. Again, they will give divisions anterior, posterior, anterior, posterior, anterior, posterior. Then they will form the chords, the lateral chord, posterior chord, the medial chord. And then these will give out the branches, that is the musculocutaneous nerve, axillary nerve, radial nerve, median nerve, ulnar nerve. The axillary artery also travels along with the brachial plexus here. Then there will also be smaller branches like the dorsal scapular nerve, then the suprascapular nerve, nerve to the subclavius. Then we'll also have the upper and the lower subscapular nerves, and then also the thoracodorsal nerve, then the medial and lateral pectoral nerves, and also the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. And that is all about the anatomy of the brachial plexus.